Hello, how are you? I'm Dr. Alexandra Mota, a physical therapist, osteopath, and author of the digital book Secrets from the Pain-Free Spine series. And today I want to teach you a really cool exercise so you can say goodbye to knee pain. But before we start the video, so you don't forget, give it a like here. If you're watching me on Facebook, hit the like button, and if you're watching me on YouTube, do the same. Otherwise, you'll finish the video, want to watch another one of mine, and end up forgetting. Don't forget, give a like and a thumbs up on the video right now. The main knee pain people have nowadays is pain in the kneecap. And usually this happens because of wear and tear, both of the cartilage and even reaching the bone itself of the kneecap. It's the well-known Patellar Chondromalacia, and the exercise I'm going to teach you today will help reduce the compression that exists between the kneecap and the femur bone. Because it's this compression, combined with movement and friction, that promotes and accelerates the wear of this joint, causing discomfort and pain. Chondromalacia doesn't happen overnight, it develops slowly over a long period of time. Usually you start with a sensation of crepitus, small pops in the knee, then you begin to feel a gritty sensation in the joint, and later the popping increases and becomes more intense. Sometimes it's even possible to hear the popping that's happening in the knee. And only after that does the feeling of discomfort start to develop into pain, which can even lead to inflammation and swelling of the knee joint. And why does this happen this way? Because in most of the joints in our body, there is a structure that protects the joint called cartilage. And this cartilage doesn't have nerve endings. In other words, you don't feel the cartilage. The cartilage wears down, breaks into little pieces, making movement harder, and you don't feel it. You feel the cracking, the crepitation, the sensation of sand in the joint only after this wear has gone beyond the cartilage and has reached the bone itself. That's when you start to feel discomfort. That's when you start to feel pain. And the main reason for this wear, this patellar chondromalacia, is the misalignment that exists between the thigh bone, the femur, and the main bone of the leg, the tibia. And because of the position of these two bones, the patella already tends to move more to the side. And that's why it's important to train a specific muscle called the vastus medialis, because this muscle will help keep the patella in the center of the joint. It will prevent the patella from moving further outward, more to the side, and increasing the compression between the patella and the femur bone. But that's something almost everyone knows, and specific training is done for that. What I'm going to teach you today is a very simple exercise that will improve the alignment and position of the tibia, which is the shin bone, and will help reduce patellar compression, reducing wear, reducing pain and discomfort. So the patella is a small triangular bone that sits here in front of the knee. About this size right here. That's about the size of the patella. So because of the misalignment that exists between the femur bone and the tibia bone, this patella forms a little angle, this patella. It already tends to move more to the side, and this greatly increases the pressure that happens between the patella and the femur bone here on the outside, on the lateral side. To do this exercise, we're going to use a reference point, and this reference point is a little protruding structure, a small bone tip that exists below the patella. Right at the beginning of the tibia, which is the shin bone, this structure here is called the anterior tibial tuberosity, or for those who are more familiar, TAT. To do this exercise, you will sit with your knee bent at about 90 degrees, your leg relaxed, and you will lightly place your hand on your knee with your fingers beside or on top of the TAT, the anterior tibial tuberosity. You will support only on your heel and make a movement rotating inward and outward like a car windshield wiper. It's important that you do both movements, but you need to insist to put more emphasis on the inward rotation, as if you were pointing your toes toward your other foot. And notice that this rotation movement happens exactly here, in this structure. I'll do it without using my hand. Now, so you can see foot in, foot out, in, foot out. Notice that up here it's still, the movement happens down here. The more you insist on bringing the tat inward, the more aligned it gets. With her kneecap facing out, she pulls the kneecap out, but when she turns it inward, it lines up with the kneecap. And to make this exercise even better, you can gradually straighten your leg a little more and keep doing the exercise. Then, try it with your leg more straightened again. Keep doing the exercise until you reach your limit and can do the smallest movement. I'm letting you know now, the more you straighten your leg, the harder it will be for you to move your tat. The tendency is for you to move your hip and rotate your whole leg, which is not recommended. The recommended way is to keep your thigh still and move only the tuberosity, only the leg, only the tibia bone. And one last tip, if you still have trouble, you can combine the movement of turning your foot inward with the movement of bending your knee. Imagine a roller as if you were trying to pull something towards you. Straighten your knee with your foot pointing outward, turn your foot inward, and bend your knee. Straighten it pointing outward, turn it inward, and bend your knee. It's time to share this video with your friends, with your family, with that person who complains about knee pain. If you're watching me on Facebook, tag your friends here, share it. If you're watching me on YouTube, copy the address from your browser or look for this little arrow here somewhere on the video or near the video. And share the link to this page, the link to this video on your social networks, on Facebook, WhatsApp, Twitter, because that way you can help this message, this tip here, reach more and more people. You can help us to reduce the pain of many people. And in the next video, I'm going to teach a very practical exercise to improve the mechanics and the sliding of the kneecap. I'll stop here for now. A big hug and see you in the next video.